This is a Puritan bed at 980 ventilator. It has the modes AC, VC, and AC, VC plus. AC, VC, AC stands for assist control, VC stands for volume control. Assist control will provide full ventilatory support for the patient. And the ventilatory control, you're going to control your tidal volumes and your rate for your patient. For AC, VC plus, that has it is sort of like a PRVC mode, and a PRVC mode, you set the pressure for your patient, you set your tidal volume for your patient, and after 3 breaths, it would, sorry.
Sorry. It will adjust.
It will adjust to accommodate the pressure, so your peak pressures wouldn't get too high for your patient.
Okay.
So,
All right, can you show us how to get to the modes on the screen?
the way you get to your modes is this box down here. You push the yellow arrow, and you'll see the mode up here, AC, and then VC and VC plus.
Okay.
And when you select one, like AC, VC plus, you're going to set the tidal rate and the volume and accept. And that's how you do it on a Puritan bed.
Okay. Can you set the tidal volume to 500?
All right. You're going to go ahead, and it's touch screen, so you're going to go ahead and touch the tidal volume. Move it up by this button over here. And push accept.
All right. So if I adjusted the tidal volume, why would I need to adjust that on the blood gas?
If you need the patient to breathe in deeper because they have a higher carbon dioxide, if their CO2 is up.
Okay.
You want them to take a deeper breath to be able to exhale more.
Excellent. Good. What other setting can we adjust to blow off CO2?
To blow off CO2, we can,
Would it be the rate? Because there are things that we can control in here because
Yeah.
we're in a control mode. We can adjust the tidal volume, which we already did. And then we can adjust the respiratory rate to make the patient, the ventilator, breathe for the patient at a faster speed.
yes.
So can you point to where the rate is?
It's the F over here.
Okay, so click on that. Good. So let's just say the CO2 was 60 and we need it to increase the respiratory rate. We would increase it. So can you adjust it to 15 breaths per minute? All right. All right. Another thing we have to control or set is the I time. And what should the I time be set at initially on a ventilated patient?
1 to 1.3.
Okay. Can you set the I time to 1.0?
All right, you go to TI over here.
Okay. Good.
So,
All right. Another setting we can set is PEEP. Can you point to the PEEP?
that keeps over here.
And what is the initial setting for PEEP?
5.
5.
Baseline.
All right. When do you increase PEEP?
For any kind of oxygenation issue, you want to try to adjust your PEEP before you try adjusting their FiO2.
You want to be able to increase your FiO2, so you would actually max out your FiO2, and then your second option when you're increasing. If the patient needs it, then you're going to max out your FiO2, and then the second choice would be to increase your PEEP. If you have a COPD patient that has an oxygenation issue and they're in like heart failure or pulmonary edema along with their COPD exacerbation, you would keep your FiO2 maximum amount of 50 to 60%, and then you would start looking into adjusting your PEEP, P-E-E-P. And what is P-E-E-P? If you
Positive and expiratory pressure.
and that is the pressure that maintains your airway in your lungs and keeps them open during exhalation. Good job. Thank you.